Good evening. This is Dr. John Bennett, broadcasting from Miami. We have tonight Dustin Kinch. He's a software programmer from originally Rhode Island, but I believe he's in Florida now. Also, we have the big cheese, Julio Pereira, MD, television star from Brazil.
No.
He's coming on the small screen tonight. He's going to give us a commentary from a neurosurgical perspective. But I met Dustin online, and once I get to know him, I knew that he was good on the internet, and he's working with a company that's pretty well known, MD Online, I believe. Is that the name of the company, Dustin?
Yeah, MD Live.
MD Live. And then on further getting to know Dustin, it turns out he made an application for a neurological a rehab from traumatic brain injury. So and I'm just going to ask you a few leading questions, Dustin.
Sure.
So you told me briefly you went down to the Virgin Islands and you were injured in a diving accident, correct?
Yeah, that's right. I went vacationing with my family the day after Christmas and had fallen from a height and hit my head.
Okay. Do you remember the accident?
Very vaguely. I remember waking up at Jackson Memorial Hospital maybe hours later, but that's about it.
Oh, okay. And that was a period of a day. They airlifted you from Virgin Islands, correct?
Yeah, that's right. I was intubated over in St. Thomas, and then they transferred me from St. Thomas over to Jackson Memorial, the Ryder Trauma Center.
Okay, that's very good. And that only takes like a couple hours, helicopter ride, or do you know?
It was a couple different stops, but I could have been a couple hours, or I hope so.
Okay, I guess you have some written stuff you want to tell us about as far as when you get to the hospital, what happened and everything. So take it away.
Yeah, so essentially this was such a different and crazy story that happened to me that the best way I can sum it up is from my neuropsychiatrist summary of what had actually happened.
Okay.
So it reads, Mr. Kinch is a 26-year-old man who sustained a traumatic brain injury with intracerebral hemorrhage and right subdermal hematoma on 12/26/2013, and later MCA stroke on January the 5th, 2014, from vasospasm after he fell approximately 10 feet onto asphalt. He experienced loss of consciousness for 5 to 10 minutes. Glasgow Coma Scale was 12 to 14 upon admission. Neurological exam following the stroke showed left homonymous, my best guess, hemonopsia.
That sounds good. Sounds good.
Yeah, well, that was my best guess of that word, but
That's good.
I had mild sensory impairment with left side extinction and neglect, and that was kind of what drew me to make this application. Is I could no longer use my left hand, and that was a big problem for someone who's a mobile developer, as I use my hands almost every day.
Okay.
So,
okay. Does it sound kind of familiar to you, Julio? Julio?
No, it's okay. Go ahead. I can
Okay.
understand very well.
Oh, okay. Okay, Dustin. So,
Yep.
So you had some pretty significant damage at that point. Now, do you
Yes.
want to continue on, or you want me to ask you some questions, or what do you want to do?
Sure, I can further expand upon some things that were
Sure.
plaguing me in the hospital. So
Sure.
it goes on to say, according to his family, he was generally confused and had difficulty tracking information, but his cognition steadily improved. Currently, he reports irritability, racing thoughts, making small mistakes when writing, which I do, occasionally using the incorrect words in conversation, which is maybe a mild form of aphasia, and being much slower in completing tasks. So I became more irritable and frustrated, which is known to be associated with head injuries. However, my therapist thought I had good insights into my behavior, and I over-personalize events. So from there, she went on to elaborate that she described a steady improvement in my mood and cognition since the accident, which was one of the bigger things. So.
Did you change screens? Because I'm still seeing the same sheet of paper.
Oh, yeah, but it's the same one. There's a lot of stuff on there.
Oh, okay, okay.
But I'll bring it back to you.
Okay. Okay, so how long did you spend in the hospital?
I was in the hospital for about 3 weeks. I had the stroke in week 2 or so, and once I had the stroke, and I couldn't use my hands anymore. This is kind of what inspired me to create this mobile application, so I could start to get my fine motor skills back, and just the tap accuracy. I couldn't text anyone because every time I hit a key, it would hit somewhere else on the phone, and that was probably in part due to my stroke.
Okay, can you tell us exactly how long of a time period it was before you started thinking about doing the app?
Well, it took me about 4 months to actually rehab, and that was including physical therapy, cognitive retraining, and a bunch of other things for my fine motor skills. And once I kind of realized that I want to try and get back into software design to see if I can still do it, I decided to design a solution for a problem that I was experiencing.
So you saw something that was lacking.
I did, yes. I saw something that, it's not like a lumosity where that's for a healthy brain. This is for people who have undergone serious traumatic brain injuries and, have lost fine motor skills. So that's something I needed.
Okay, so it's essentially a fine motor skill app.
Yes, it's very heavy on your hand-eye coordination with your tapping and your thumb, and specifically your swiping. So this is how you play the game: is you have to swipe based on what round you're on, and part of this was character recognition. So part of my deficits was I struggled to tell the difference between numbers and letters and symbols and character recognition. Maybe a mild form of aphasia. But this is something I tried to do, was delineate the letters through the numbers and identify it and swipe accordingly.
Were fine motor skills the major deficit, or just major to you because you use your fingers so much?
They were major to me, which inspired me to create a tool to help me get better. I'd imagine that everyone likes to use their hands, so maybe other people can use them eventually. Okay.
Why don't you take us through the app?
Sure. So the application pretty much starts very straightforward and self-explanatory for some of the lower level and higher level people that are going through traumatic brain injury rehabilitation. So round 1 says just sort out the letters. And so all you do is go down and swipe the letters from the numbers. That's the key of delineating between numbers and letters. And then after that, your rounds would complete and you could move on to the next rounds. So for example, this round we would have weather. So you'd have the clouds and the sun mixed in with the wrenches and all that. And it seems very rudimentary and elementary to someone like you and I, but for when I was recovering from my brain injury, this was very challenging stuff. Another one was coloring. So for example, this round 4, you had to separate the blue numbers from the black numbers. Again, very easy stuff, but to someone who's rehabbing, this is stuff that you need to kind of master.
So you were having a hard time with color recognition?
Yep, color recognition, symbol recognition, numbers and letters, and specifically the ability to move my fingers. So to win the game, you have to swipe across. If you notice that little rain cloud is kind of moving to the right, that was because I had swiped it to the right, and it will move all the way to the right. And eventually, once you do it enough and you get the right ones, you move on to the next round.
Okay. Wow, that must have driven you nuts not being able to use, especially and we're so iPhone based now, our society.
Oh yeah.
Using small devices with that's you're lost without character recognition. You're lost.
Yeah, and I could you can't text anyone,
Yeah.
Yes.
Wow. So
Justin.
Yeah.
Did you use any neuropsychological tests that your psychology used with you, or you create the test and everything in that too?
That's a good question. So a lot of my rehabilitation was done in pen and paper, which is kind of why I thought there was a pretty good opportunity to do this, because there was not a single mobile application in my rehab. And so I saw, an opening and an opportunity, but I had to kind of conceive the way to, for example, in my rehab, they would have me circle the number, just give it a circle. Whereas now translating that to a mobile device, I made that a swipe with my thumb to kind of attack 2 different pieces of the rehab in one.
Yes, excellent. And did you show for your neuropsychology?
I never got a chance to make it back. Well, I was I lost my job, and that was my health insurance. So I couldn't make another appointment. They're very expensive people, the neurologists.
Yes.
So bad. So, but yeah, I never got a chance to show her. But maybe one day I'll go back and show her.
Yes, very, very interesting.
Thank you.
I saw some apps for autist people.
Yeah, so
And for for other especially children, you know, especially children used to rehabilitation or something like that. And can you share your exam with your doctor by email or something like that?
Ideally, I'd like to, because I had originally bootstrapped this, and I designed it and built it myself. Going forward, I'd like to kind of make the software a little smarter, meaning it could learn if its user was very low level or high level, if it was struggling.
Yes.
So yeah, I put the clock on it. If you look in the top right, there's a there's like a timer. You see the timer, and that would kind of yeah. So if it took you over 1.5 minutes, that would mean you're in a kind of you're very yes, exactly. And where if the lower the time was, meaning you could just fly through it and there was nothing really wrong with you. So if it took you a long time, that was how I want the program to kind of learn that its user may need more attention.
So you essentially get better by repetition.
Is
that part of the rehab, or?
It is, but those are randomly generated sequences of numbers and letters. So it's never the same. So the user can't. Repetition will be good because it'll retrain your muscles. Right. However, we don't want them to start memorizing patterns so that they can't identify them. So.
Right. So yeah. So part of the game is character recognition.
Of course, yeah.
The right one, and then, so when you say fine motor skills, it's not the moving of them, or it's it's a recognizing of the character and the motor.
It's both. It's both in one, because after you recognize it, you got to move it to the right or the left, depending on what your hemi-neglect is. Myself, I couldn't see things on the left, whereas a patient who suffered from the right would want to swipe right. And you get what I'm saying?
Yeah.
Yeah.
Yes.
Well, this is kind of a question for Julio. Yeah. Julio, do you ever see people with just an isolated motor skill, fine motor skills and character recognition? Is that possible in brain injury? Or does it usually accompany other more severe deficits?
It depends a lot, especially where is the deficit. You have to see the MRI, but it can happen.
Have you seen many cases of that? Of just isolated fine motor?
No, it's few. No? I cannot remember anyone that has only this kind of.
So usually it comes with other more severe injuries.
Yes.
Does it accompany most major brain injuries, or every one is different? Every injury is different.
It's different. It's very different, because as neurosurgeon, your point of view is more simple. You have to operate or not operate. Usually, you need other kind of like psychology, neurology. We have to work together.
Oh, okay.
And usually neurosurgery point of view is more, where is the lesion? I have to operate this. Of course, you do neurologic exam, but it's a little bit different.
Oh, okay. So you consult the neurologist as far as continuing care and rehab.
Yes. Okay. Neurology and psychology too.
Okay. Did you, Dustin? Do you have any burr holes to relieve intracranial pressure? Do you remember, or no? You don't.
The only thing I got was the femoral artery angiogram. Maybe they had to go up the artery in my leg.
Okay.
They sprayed verapamil. I don't know, and it opened up the vasospasms. This I don't know. I'm not a clinician, so I'm just doing my best.
Did you have any feedback from patients about your app?
I kind of just finished it. This accident just happened to me last Christmas. So I have never even put it out there. I just kind of built it for myself and played with it until I got my hands back to where they were, as far as I can tell.
Yeah.
Well, maybe Julio, you could give it to some of your patients. It's free.
Yeah.
It's free.
Yes. Because for me, what's very interesting for your app, Justin, because apps, you can change, so that's the first start, because sometimes the patient has deficits as you, but you can put more, other kind of rehabilitation.
Oh, of
for
course.
me, yes, it's very interesting because all the time the family asks, how can I help? And your app do this,
Yeah.
family can be involved, can understand, can give any feedback for doctor, and the patient can work at home. It's very interesting because for me, brain it's as muscle. You have to work more and more and more. So congratulations, very interesting.
Thank you. I'm still trying to get back to, but thank you. I appreciate that.
Well, one way that struck me very personally. I had a friend that I played hockey with in college at Brown. Matter of fact, Dustin's home, where he suffered a stroke, and it was amazing how much rehab. Like, he wasn't really being serious about rehab, and I'm sure Julio and Dustin can relate to this. He was just so depressed. He had a pretty large, I guess, deficit one side of his body. But the doctor sat down with him and said to him, "Look, you're either going to be totally paralyzed on one side of your body, or you're going to work your ass off and be almost normal." Yep. And you know what? He worked his ass off, and you couldn't tell he had any kind of injury today. He's got a little problems with short-term memory, but not much. Not much. But it's incredible how much rehab did for him. Everyone was amazed how much. But he was an athlete. He knows how to work hard to get in shape, and he worked very hard, and he did a great job in rehabbing. So I guess have you seen a lot of that, Julio, where patients really don't work hard at rehab? They're very depressed, and yet they have to kind of snap out of it if they're going to make any progress.
Yes, a lot. Sometimes after a brain surgery, when the patient has some kind of deficit, I don't know, but I feel, depends a lot the patient. Because some patients, just stay at bed, don't like to physiotherapy, and it's changed the outcome a lot. Sometimes it's difficult to how to express this, but some kind of personality improves so fast, especially the patient that is involved with treatment, as Justin, never mind what the doctor say. He say, "I will improve by myself." It's very important.
Yeah,
certainly.
It's certainly a devastating blow, but some people seem to overcome adversity well. Other people don't. I suppose that's probably why, as you mentioned, Julio, the psychiatrist gets involved.
Yes.
To kind of evaluate the person, to try to motivate them or find out, is there lack of progress due to a psychiatric, maybe like depression. I'm sure depression is almost like a normal accompanying problem, right, with a lot of brain injuries.
As far as yes.
Especially because brain injury, the patient's young. That's the problem. So he's completely, health, and one day he stopped to do everything, and it's staying in ICU. Just if you stay in ICU, usually you have some kind of psychiatric or psychological problem, because you don't know what time it is. All the time someone go and do some testing, you stay. It's like a prison. So it's hard, especially if you are 20 years old or something like that.
Yeah. No, I've seen patients, once they leave the ICU, they get better just from being away from the constant noise and the constant testing.
Yes.
Just being in a quiet room, it's like, wow, they got better. It was just a change of scenery.
Yes, it's happened a lot.
So Dustin, so you're going to release this? It's available in the iTunes store now, right?
It's in the App Store. Yep, I put it out a couple months ago, and as of right now, it's just there. It's free, so go play around with it if you like.
Yeah.
Okay. Is it going to be available on Android also soon?
I mean, maybe. Yeah, if I can find the time. So I've actually just recently started working again, so I'm kind of tied up with that, with getting back on my feet. But I'm kind of lucky. Everyone along the way has told me that. Good lucky to be back. So.
Are you using the app yourself to rehab?
Yeah, I was using it almost every day just to make sure that my left hand and my left side got back
Really?
yeah, yeah, absolutely.
How was your left hand now? Is it almost back to normal, or
Yeah, it's perfect. So yeah, well,
is
it's
that is
very
that
great.
is that, is that due to rehab, you think, or a natural progression of things?
Oh, I think that was definitely due to rehab. It was a kind of a multi-pronged approach to the rehab too. It was not only physical. I had a lot of cognitive retraining, learning those executive functions again. So it was a lot of different stuff that went into to me getting back to where I needed to be.
Well, how'd you learn those executive? I don't even know what executive functions are, but
Well,
how'd you learn them?
well, for example, when I was in the TICU, they would have me count the months backwards, or count backwards from 100 by multiples of 7. Those not very challenging puzzles, but to someone with a brain injury, you have to think about it. Okay, 193,
Right.
86. So, you got to go all the way down, and you just keep trying and trying and trying. They were tricky, but it made me wonder how I could do before the injury, because some of them were kind of hard.
Mhm. Wow. It's good to see that there's something that patients with traumatic brain injury can do to help speed their recovery.
Yeah.
Um, so, Julio, anything else to add?
No, no, it's very interesting. Just some advice. If you put other patients involved, it could be better. Because sometimes when you are a doctor, you have a lot of steps, when you want to create some kind like this. And sometimes patient can do better than doctor, because you suffer, and if you put other patient involved, there is some kind of society of patient that suffer brain injury. If you talk with this society, could be very interesting to improve your app, because
Well, you just provided me a way to ask Dustin to start one,
Yeah.
because I think I may have mentioned to Dustin before. There are TBI, they call them TBI,
Hmm.
support groups out there,
yes,
which I think that this platform of Hangouts is excellent for support to have people like Dustin be able to and other patients to be able to communicate in live fashion, and they can learn about apps like Dustin's, or they can learn about their progress, or uh, where they're at, or if they have any kind of questions. I know as a patient, when I had a cardiac problem, my doctor didn't have time to talk to me. And he's a great doctor. He did a great job. But I mean, he's got a lot of patients to see, and he's got to go to another room. And I would be chasing him down the hall to say, "Well, wait a minute, I got a question." But if there's these support groups, you can take your time. You can talk to other patients, and which is what I did. I got online and talked to other patients with a condition called atrial fibrillation, and I got some great information. We took our time, talked on the internet, and we talked about the different kinds of treatments, and how, what the symptoms they had, and what were the good devices to get to monitor my heartbeat.
yeah,
I mean, tremendous. I mean, the doctor didn't have time to do that,
yes,
to sit down with me and tell me about the apps and the devices to get to help me recover from my atrial fibrillation. And
yes,
I'm sure you're the same way, Julio. You got to see a lot of patients. You can't sit down and
yes,
talk. You can't talk to the patient. I'm sure
yeah,
you'd like to, but you don't have time.
yeah. It's different point of view. I ask all my patients to go online, find the other patients, because some kind of details doctor don't know. For example, I work with a brain tumor. I don't know what kind of benefits patient that have a brain tumor can has. Sometimes patient teach me. In Brazil, if you have a brain tumor, you don't need to pay some kind of tax, or you can buy a car cheaper. Do you understand what I mean?
Okay.
So it's important,
Okay.
but the doctor don't know this.
Yeah.
Sometimes about exams, some kind of details. I never do a angiogram as so you know more than me.
Hmm.
I know how to explain, but I never feel. You understand
Okay.
what I mean?
Yeah, I
Well,
understand.
well, that's exactly why I think Hangouts will find a real good use is in support groups. We're trying to do that with epilepsy and Parkinsonism, so people can easily talk to each other and not have to like just text or write an email. You can see and you can talk and you can interact. Live interaction, I think, is one of the uses of the Hangouts, which I think will get bigger. And it allowed us to meet Dustin, talk about his app, and to talk to you about your. I mean, it's a very valuable thing. So we'll wrap this up, and thank you guys for coming out. Hold on, I'm just going to go off camera.
Sure. Thank you, guys.
Good day.